Hello everyone, I am Sriha from Geetanjali College of Pharmacy, currently in my second year of PharmD. Today I'll be discussing this chronic neuromuscular disease called Myasthenia gravis, its epidemiology, etiology, clinical manifestations, and management options. Coming to what is myasthenia gravis. Myasthenia gravis is a chronic neuromuscular disease that causes weakness in voluntary muscles. These muscles include those connected to our bones as well as muscles in the face, throat, and diaphragm. They play a crucial role in the movements such as breathing, swallowing, and facial expressions. Myasthenia gravis is an autoimmune disease, meaning that the body's defense system mistakenly attacks healthy cells or proteins needed for normal muscle function. Coming to the epidemiology of myasthenia gravis, a 2021 systematic review and meta analysis estimated that myasthenia gravis affects 12.4 people per 1 lakh worldwide. However, the prevalence can vary depending on location and has been increasing over past 50 years. Other estimates suggest that myasthenia gravis affects between 70 and 300 people per million globally, which translates to approximately 7 lakh people worldwide. The age and sex incidence of myasthenia gravis is 0.68 per 1 lakh person years, with the highest incidence in the age group of 70 to 74 years. The incidence in female is 0.76 per 1 lakh, and coming to the males, it's 0.6% per 1 lakh males. The admission mortality rate is 14.69 per thousand. The etiology of myasthenia gravis is usually caused by an autoimmune problem where the immune system mistakenly attacks healthy tissue. In this condition, antibodies attack acetylcholine, a neurotransmitter essential for nerve and muscle communication. This leads to the muscle weakness that characterizes the condition. The exact cause of this autoimmune reaction remains unclear. Coming to the clinical manifestations of myasthenia gravis. The clinical manifestations of myasthenia gravis can vary widely among individuals. Patients typically experience muscle weakness that worsens with activity and improves with rest. Common symptoms include drooping eyelids, blurred or double vision, difficulty swallowing, and shortness of breath. Coming to the ocular symptoms, diplopia means a double vision, ptosis means drooping of eyelids, ophthalmoplegia means paralysis of eyes, and the respiratory symptoms include breathlessness, weak breathing, and respiratory failure at worsened conditions. And the limb and neck symptoms include dropped head, and the symptoms are mostly seen in the proximal part than the distal part, and it affects more to the arms than the legs. And the bulbar symptoms include the fatigable chafing and dysarthria, which means difficulty in speaking, and dysphagia, which means difficulty in swallowing. Coming to the pathophysiology of myasthenia gravis. As we all know that the myasthenia gravis is an autoimmune disease. Hence, the first step includes the autoimmune response initiation, which is characterized by genetic disposition of the genes and other environmental factors. These trigger the production of autoantibodies against the acetylcholine receptors or muscle-specific kinase. These autoantibodies binds to the acetylcholine receptors or muscle-specific kinase at neuromuscular junction, causing the destruction of acetylcholine receptors by complement activation, inflammatory response, endocytosis, and ultimately leading to the degradation of acetylcholine receptors. And this causes the decrease in the number of acetylcholine receptors at neuromuscular junction. Hence, the decrease in receptor causes impaired neuromuscular transmission that include decreased efficiency of synaptic transmission and reduced muscle contraction. Hence, it leads to the appearance of the clinical manifestations such as muscle weakness, fatigue, ptosis, diplopia, dysphagia, and respiratory difficulties in severe cases. Coming to this part, we can observe that the neuromuscular junction where the acetylcholine receptors are blocked by the autoantibodies, which causing the difficulty in transmission of the signals from the nerve to the muscle. Next, coming to the diagnosis of myasthenia gravis. It can be done by blood test which measures the levels of self-reactive antibodies that drive myasthenia gravis. The next test includes the IcePack and Tensilon test. Briefly increase the acetylcholine levels. Temporary improvements in muscle strength may indicate myasthenia gravis. And repetitive nerve stimulation test measures the nerve cell's ability to transmit electrical signals to muscles. And single fiber electromyography measures the response of individual muscle fibers to stimulation. And imaging scans include the images of the body, can look the thymus abnormalities and rule out other conditions. Coming to the management of myasthenia gravis, the pharmacological therapy includes several medications that can help manage myasthenia gravis. They include acetylcholinesterase medication such as pyridostigmine, which improve the communication between nerve and muscles, and corticosteroids such as prednisone, which blocks the immune system's ability to produce antibodies, are also given. Coming to the immunosuppressive agents such as cyclosporin, which are transplant type medications, and rozanolixizumab noli, which is approved in 2023, which is the first FDA approved treatment for both anti-acetylcholine receptors and anti-muscle specific kinase antibody positive myasthenia gravis. Management of myasthenia gravis can also include surgical and procedural interventions such as thymectomy, surgical removal of the thymus gland, and plasmapheresis. The procedure removes abnormal antibodies from the blood and replaces them with normal antibodies from the donated blood. And intravenous immunoglobulins, a blood product that helps decrease the immune system's attack on the nervous system. For more information, please refer to the sources such as National Institute of Health and Cleveland Clinic and Mayo Clinic. Thank you for your attention. I hope this presentation has provided you with clear understanding of myasthenia gravis.